At Consig, the area that we're really focusing on in that life cycle is the patient communication. And we look at it not automating for automation's sake, but how do we scale and increase the number of clinical conversations that can be enabled, that can lower the amount of administrative work that needs to be done. We've built a platform that automates that, but really the whole point of automating it is to increase the number of patient connections. I fundamentally believe healthcare is really a human piece. It's really about making people feel better, and you can't automate that all the way out. But what we can do is enable a lot more conversations that matter. So one of the examples with one of our first customers, they did follow-up with patients as part of the claim process. How is it going? Working really on behalf of the payers to make sure things haven't gone off the rails. They have to reach over 1 million patients a year at scale. And the amount of people that it takes to really do those follow-ups and have meaningful conversations is a problem. What we were able to do is automate 80% of the outreach for them and really let their team focus on the 20% where people were ready to have a conversation. Think about any sort of patient outreach, proactive communication, check-in. Most of the time when you connect, you get voicemail, you get call screeners, you get people who are in the car and can't take the call at this time. What we did is it's tempting to try and automate the whole thing. We actually looked in and said, what parts of this can we take that are really painful for the administrative staff that was doing this and take that off the table for them. So they were just having patient conversations at the end. And like I said, we were able to automate 80% of the outreach, and it completely changed the operations. It saved them about $700,000 a year because they were able to bring back 10 FTEs and reallocate them to other tasks.